Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Get ready, Elkins and Randolph County and the surrounding area. WVU Medicine is bringing healthcare even closer to home. WVU Medicine, United Hospital Center, recently broke ground for the construction of the $37 million Elkins Corridor Medical Center. Described as a hospital without beds, this comprehensive medical center will include cancer services, cardiology, urgent care, family medicine, labs and imaging, and so much more. So today, we're talking with Dr. David Hess, President and CEO of WVU Medicine United Hospital Center, about the Elkins Corridor Medical Center and the expected impact on healthcare in the Randolph County area. Welcome, Dr. Hess, to Live Healthy West Virginia.
Thank you for having me, Mary. It's an honor.
Well, it's great to have you here. This is exciting stuff.
It's very exciting.
It really is.
You're almost as excited as I am.
I am.
That means a lot.
I am. Definitely I am. So let's start with, what made you decide to build a medical center in the Elkins Corridor?
Yeah, so I think the key to healthcare, and again, I think it's because of my physician background, is you have to listen to your patients. They'll tell you what to do, what they need, what to bring to an area, what services you need. So we had already had some practices in Elkins, small practices, cardiology practice, UHA, our physician division, academic division, had some practices down there. And we kept hearing from the physicians, hey, my patients are begging for more WVU medicine in Elkins and Randolph County. So, Albert and I got together and we said, look, we need more space down there. There's a demand, there's a want for us to have more services down there. Let's think of a solution for the problem for the folks in Elkins that want to access WVU medicine. So again, United Hospital Center was the closest kind of regional hub to that area. But really, Mary, this is an entire WVU medicine project. This is through United Hospital Center, but this is all of the power that we say of WVU medicine converging on Elkins and Randolph County. But really, it's not us imparting ourselves on them. They wanted it. They were asking for it. So that's really
the people what they wanted.
Absolutely. and again, that's when you win. When you marry up our vision of WVU medicine providing improved lives, improved healthcare for the rural, everybody, every square inch of the state, no matter what hollow or what rural area you live in, we're coming. And the beauty of this project is that we're coming, but we're not bringing our B, C, or D team. We're bringing the A team. We're bringing the starting unit. And, that's what I'm excited about. I think the other reason behind this, Mary, is from our standpoint, the doctors wanted to come here. We're not dragging doctors to Elkins kicking and screaming.
They want to go.
They heard whispers of the project. They're reaching out to me. They're reaching out to Albert. They're reaching out to Skip Yolberg at St. Joe's and saying, hey, I want to be in that clinic.
Yeah.
And that just speaks to the commitment of our physicians to the mission of, I'm willing to go into rural, geographically isolated communities and provide high quality healthcare. So again, it's the beauty of all of WVU medicine coming together for one project.
And wouldn't you say this is part of the WVU mission to deliver healthcare to underserved areas?
Absolutely. When you compare WVU medicine to other health systems, there's a lot of differentiators. But again, I've been at multiple hospitals. I've been blessed enough to lead multiple hospitals within WVU medicine. And I've taken over at hospitals where other health systems have vacated and left. In my mind, this is exactly in line with WVU's mission. Some health systems, not us, go into communities and act like a vacuum cleaner, and they suck all the healthcare out to a big academic mothership somewhere. We act as a snowblower. So when we go into communities, we blow as much services and as much talent as we can into communities. And I always say, we're not an academic health system. We're also an academic hope system, because we go into communities and reinvigorate healthcare, but we also really reinvigorate the entire community. There's a pride associated with your healthcare that you have in your community. And what better marker of a pride than to have a partner with WVU Medicine in your community, the flagship healthcare institution for the state, is in our community. What a sense of pride. So we see that every small community we go into, the community rallies behind it, they get excited about it, they get really proud. And I can tell you that I went the week after our groundbreaking and spoke at the Rotary Club in Elkins. And you can always tell how your talk comes across from the amount of people standing there waiting for you to ask side questions when you're done. And I couldn't get out of there. They were so excited about the project. And it was a lot of, hey, what's in it for me? Is my doctor coming? Are you going to have this service? But it just speaks to the excitement of the community as to us bringing WVU Medicine into Elkins.
Wow, that's great. This has been described as a hospital without beds. I love that description, but I want you to tell me exactly what do you mean, a hospital without beds?
Well, you're very sharp. That's the number one question I get when I'm asked about this project. And really, it's a concept that I think is not unique, but it's something that I think encapsulates what we're trying to do. And Albert challenged us at the UHC team to go in and create what he's terming a hospital without beds. And what that means is we want to try to pack everything into this ambulatory clinic, this outpatient clinic, everything that we can in there except for overnight hospital stays and surgeries.
Okay.
So when you think of probably 90% of the healthcare that we all need, it can all be accomplished in this building. Wow. Because we don't always need surgeries, right? We don't always need to stay overnight in a hospital. When you do, we can do that with one of our other WVU Medicine facilities. You can go to St. Joe's over in Buchanan. You can come up to United. Sometimes you need to come to Ruby. But 90% of the healthcare we think can be captured within this building. So really, everybody comes to a hospital for their healthcare. We're saying, hey, come to this place. It's basically a hospital, but you can't stay here overnight, and you can't get surgery here, but we can really do everything else. I think in your opening, you captured that we were going to do infusion services and urgent care. Again, if you're a little dehydrated or you need IV fluids, you're going to be able to get that here. You're going to be able to get so many services here that really we're going to capture most of healthcare in this, what we're calling a hospital without beds.
And they don't have to drive an hour or two to get these services.
And that's really what patients want. They want high quality, they want the A team, they want the best of the best, but they want to go 5 minutes, 10 minutes, 15 minutes.
Oh, sure.
And again, we do a great job with telemedicine. That's always an option, but sometimes people want to come in person. And for some exams, it's very challenging to do over telemedicine. So we think this is a great opportunity to provide a very, very long foyer, but put our front door of WVU Medicine right into Elkins.
I always say, it's in our front yard.
It is,
That's
absolutely.
What it's doing. It's moving it to their front yard.
Absolutely.
Up there. Okay, so 90% of the healthcare is going to be in this building. So let's get into details.
Yes.
So what exact services? And I know there's a lot.
There's a lot, yeah.
Now, our show's not that long.
No, I know, yes.
But tell us what are the exact services that are going to be offered here?
So, all of healthcare, the core of all healthcare is around primary care. So we would be remiss if we opened up a clinic and didn't have primary care. So there'll be primary care. But also, we want to make sure that for those semi-urgent needs, but not really emergency needs, we're going to have an urgent care center 7 days a week. So what that means is you can get your routine care there on an elective scheduled basis. But oh, by the way, if you get a cough, you sprain your ankle, whatever, you can come in and be seen in the urgent care after hours. Everything will be on Epic because that's what ties us all together. Yep. That's the tie that binds. So all their information is going to be on Epic. They stop in. It's pretty much a one-stop shop. Then if you need subspecialty needs, that's where you're really going to see the power of WVU Medicine. Yeah. That's where you hear about all these subspecialists that say, I want to be in Elkins. So starting down the list, cancer. When you're going through cancer, you don't feel well, you don't want to travel, even if it's 45 minutes or an hour to UHC. So we thought it was paramount to offer cancer services, chemotherapy, infusion. Then the next most common issue that sometimes we deal with is orthopedic surgery. So, we're all getting older. You're not as much as I am, but we're all getting older. We all need orthopedic surgeons for something, right? So that's important to have in there. We'll have gastroenterologists there because everybody has stomach problems and a lot of people need to get screening colonoscopies done. We'll have OBGYN services there. So they were wildly excited, and kudos to our new chair, Dr. Casey. His team is wildly excited to be there. They've reached out to me personally saying, I want to be in this building. Beautiful, love your concept. So again, you're getting doctors asking for it. So OBGYN will be able to follow up with our mothers there and expectant mothers. We'll have rheumatology, we'll have infectious disease, we'll have ear, nose, and throat. The ear, nose, and throat doctors at UHC have reached out to me multiple times wanting to be in this clinic.
Wow.
They have a lot of patients that they already service in Elkins that drive up to United Hospital Center to seek services. Now they can do it in their own backyard, their own hometown.
Yeah.
So as you said, the laundry list goes on and on. In a short podcast, I better limit it to that. But many other services that we're going to be able to offer. I'd be remiss if I didn't say cardiology.
Oh, yes.
HVI is already in that area. Vinay Badwar has been a great partner for us in Elkins. We also have a doc employed under UHC who's in there, Dr. McKnight. We're going to bring them all together. They're going to both be located in this building. So you are going to have absolute rock star cardiologist right in Elkins, where you never have to leave. Absolutely. Yeah. That's what I mean.
Yeah, definitely. So what's your favorite part of this facility?
Oh, boy. I was hoping you wouldn't ask me that one. So let me just say that I truly feel like the design elements of what started at Waynesburg Clinic, then rolled over into Fairmont Gateway. We are keeping that beautiful design element.
Okay.
So you're going to feel like, hey, wait, is this Fairmont Gateway? Wait, no, I'm in Elkins. It's going to seem just like our other clinics. We have tweaked and improved some of the patient throughput parts of it. But I think the thing that excites me the most is what we really tried to do and what we really tried to think of was the layout of the infrastructure of the building, meaning that we put the patient at the center of every design element that we have so that they didn't have to walk very far to get to certain areas. Probably the most important areas were the urgent care, which is going to be up front, cardiology. You know, if you're a cardiac patient, you don't really want to walk to the back of the building. So again, it was putting those the very thoughtful touches on what's important to patients and where should things be. So, you know, the x-ray machines and that's going to be up front and the lab area. So, you know, I think just thinking about it and walking through the building from a patient's point of view was important. And that's kind of my favorite part of the building, other than the normal, beautiful outside elements that I think our buildings are known for. And it's going to pop, Mary. If you get a chance to go down there, it's right on North Randolph Avenue. So there's two exits to go off of Corridor H to into Elkins. And it's the downtown Elkins one. You go, before you hit downtown Elkins, there's a big, flat, wide open 7-acre parcel that we bought. Okay. And it's going to be bam, right in your face, right before you get into downtown Elkins. To make a statement that WVU Medicine loves Randolph County, we want to be in Elkins, and here we are. So, but I think there's so many great parts to the building, but probably my favorite would be the design from a patient standpoint of it.
Yeah. Well, that's such a beautiful area up there, too. It's going to fit right in.
It's stunning. It's beautiful.
Yeah, that's nice up there. Okay, so it's a hospital without beds, but is there the possibility that down the road someday you may add beds?
So, yeah, great question. When we designed this, and I think you were secretly in our meetings, you know, we designed this, we thought, you know, you always have to think, what's our 3-year plan, what's our 5-year plan, and what's our 10-year plan? So we thought for the first couple of years, this is going to be the amount of space that we're going to need. However, I will tell you that I've heard from primary care providers in that area already. Obviously, I talked about the community. I'm worried that we're going to have to flip to that 3-year plan sooner than we thought. Our 3-year plan is, well, as I mentioned, we did buy a 7-acre parcel. We have opportunities to expand. The current structure of the building will actually allow us to use space inside of the building to put 2 operating rooms in. So if we were to get a certificate of need to open up operating rooms in that building, we could flip it pretty quickly. So that's exciting. We do see that the patients in that community would probably like to have their colonoscopies there. They would like to have scopes done from urology standpoint. That's going to be another specialty there. So there'll be minor procedures that we can do in these rooms. So we've thought about that from an expansion standpoint. And then, if we were to ever get a CON, we can obviously expand and do even more.
Tell everybody what a CON is.
Glad you stopped me. Certificate of Need.
Right.
West Virginia is a Certificate of Need state. So anytime you want to open up new services, you have to go through the proper channels at the state level. And that can take a little bit of time. But, if we were fortunate enough to get a Certificate of Need in that building for basically anything, we would love to grow into that area and really be just the number one go-to healthcare provider in that area.
So you're thinking about expansion in the future?
Already thinking about it, Mary.
That's great. Okay. How many new jobs are going to be created by this?
Yeah, great question. Day one, it's going to be somewhere between 20 to 30.
Okay.
But again, you hear about we're going to kind of sneak our way in there. We're going to start this, we're going to start that. We envision, though, probably our down the road number will be somewhere between 50 to 60.
Great.
Understanding that there are going to be people that work at Ruby or that work at United Hospital Center that are from that area and say, hey, pick me, I want to go back home. But what we envision is there's going to be a lot more people, and what we really want is that we want to train up the folks that are already living in Randolph County, bring them to Ruby, bring them to United Hospital Center, train them in our cancer centers, train them in our ear, nose, and throat offices, train them in our gastroenterology offices, and then deploy them back in their hometown.
Oh, that's
so we
a great
train
point.
them like they're WVU, and then we send them back to their home and say, now you're our representative, represent us well. We think that's a great model, and that's what we envision for Elkins and Randolph County, is to train people local, bring them up to Ruby or UHC, train them up, and then let them go and practice in this building.
That makes a lot of sense, too.
Yeah.
So this is obviously, we mentioned this earlier, I mean, this is going to cut down, because I know sometimes we have patients traveling like 3 and 4 hours to come to Ruby.
It's a lot.
This is going to save a lot of people a lot of time.
So you nailed it. And what we hear from the community when we're down there is, thank you so much. I used to have to take mom to her appointments once a week, twice a week, and we had to drive to Ruby or we had to drive to United Hospital Center. And I think you're basically putting your life on hold. And I know they don't mind doing it because of the loved one, but can you imagine the life-changing, life-altering event that happens when we put it 10 minutes from them, 5 minutes? Now we've given them back 2 to 3 hours a day just by putting it there. And they're so appreciative, and they want us to know, how fortunate they feel that we would want to do this in their community. And I think that, that's going to go for it. Elkins is interesting. I've been obviously spending a lot of time there. Elkins is actually kind of a regional hub for a lot of areas in that part of the state, all the way down to, Rock Cave, Mill Creek, and, Pocahontas County, and down into Snowshoe. Like, a lot of people come up to Elkins to shop, to get their health care. So not only is this going to be serving the folks in Randolph County, but it's also going to be serving the surrounding counties too, that come to Elkins as a hub. And we've worked with their local delegates, and the mayor of Elkins has been incredibly supportive, Jerry Marco. And, they are reminding us that, Elkins is kind of the gateway to that area of the state that we really don't have a great large footprint in. And that we also know when the corridor project gets finished, it's also going to be a gateway from that part of Virginia for folks to come over, and they already come over and travel and experience our beautiful part of the state. Now they may even come over for healthcare. So it's a great opportunity.
So when's it going to open?
Great question. Though I will tell you that we put our contractors on an incredibly tight timeline. They all barked about it, but they all were okay with it. So the contractor timeline is 12 months. Then we have to do some finishing touches. We got to move furniture in. My biggest goal, Mary, was they have the Forest Festival in Elkins, and it attracts 75 to 100,000 people that week. I wanted to be open for the Forest Festival next year, which is in September. We are going to be...
That's aggressive.
It's a very aggressive timeline. But we will be open, God willing, for any type of patient for the Forest Festival. with no disasters or catastrophes, as long as they don't happen, we will be open for the Forest Festival. That was my ask, and that was because again, I didn't want to have a project open in Elkins and miss the deadline of the Forest Festival when so many people converge on Elkins and are in that festive mood, and then look over and say, wow, WVU Medicine has a beautiful facility here. So the contractors are willing to do it, and we're going to go for it. We're excited.
Wow. That's great. That's going to happen sooner than I thought. That's awesome. So would you say rural healthcare is the WVU Medicine specialty?
I would say everything is WVU Medicine specialty. And I don't say that's flippantly, but we're so good at high-level, world-class care for Alzheimer's and heart disease and heart valve. And we just do so many amazing cutting-edge things at Ruby. But then we also pivot in these rural areas, and we're going into every nook and cranny of the state. UHC, West Union, we have a clinic in West Union and Pennsboro, and I said this at the opening. There are only about 10,000 people in Barber County. And we have Braxton County. And we have a hospital in Braxton County.
Yeah.
No other health systems are putting a hospital in a county of 10,000 people.
True.
And we have one, and we're investing in one. I just think we're kind of good at everything. Yeah. And I hate to just pigeonhole us into rural healthcare, but we are so good at rural healthcare. And I think it's because we've bought in and employed people that make it a priority and a passion for them. I mean, when you have doctors and nurses and secretaries and registration people that say, I want to go to Elkins, or I want to go to Dodgers County, or I want to go to Pennsboro. Wow, you've got bought in employees that think, I want to be part of the success of this organization. Then the only way to do it is for those can-do people. And I always say there are two types of people in this world: people that run to problems and people that run from problems. And we have people, this Elkins project is a prime example, that are all jumping in and saying, we're gonna help the people in Randolph County. We all want to go on site and be a part of the solution. And I think that's truly, when we talk about the power of WVU Medicine, that's the power of WVU Medicine.
Wow. Good stuff.
Yeah.
Good stuff. Okay, so before we go,
yes,
what's the most important thing you want people that are listening or watching this podcast, what's the most important thing you want them to know about the Elkins Corridor Medical Center?
Yeah. First thing is, we talked a little bit about, this is what the community wanted. But really the most important thing is that we are going to pack as many specialties, as many things into this building as we possibly can to be there for the community, so that we can be the primary caregiver and the primary healthcare provider in Randolph County.
Excellent. Excellent. Well, thank you so much for sharing all this information.
It's been a pleasure.
And I'm sure they're all very excited up in the Elkins, Randolph County and surrounding area.
They are.
And it's going to happen sooner than they think, huh?
Very soon.
All right.
Very soon.
Great. That brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on WVU Medicine United Hospital Center and the care it provides, visit uhcwv.org. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the new Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Hess and everyone at WVU Medicine, thanks for joining us.